Hey everybody, Dr. Tom over the Active Healing Center. It is Mobility Monday and we are going to focus on a specific problem. It's probably one of the most common reasons you're seeking care at some sort of medical office, healthcare facility, chiropractic office, and that is osteoarthritis, aka the more descriptive term would be degenerative joint disease. Your joints are breaking down at a faster rate than we want them to, that they should be breaking down, and that is a problem. And our main focus for today's video is we're going to hit that upper part of the spine, major critical area, not only to how your body's functioning physically, but also neurologically. All the messages that come from and to your brain through your body have to travel through that upper part of your spine. So we want that area to function at its highest level possible so that one, your body can move properly, but two, is getting all the proper signals and messages from your brain. That is imperative in order to have great health and great mobility throughout your lifetime. So we want that area to work really well. What's the most common reasons that we're having this problem with arthritis? Most commonly is because you've had maybe some sort of trauma. We're talking specifically about that upper spine. Some sort of trauma, like a car accident, a whiplash, a head injury, some sort of sports-related injury, a lot of wear and tear, at the computer all day long, head down position, all that stress. Your skull on average weighs 12 to 15 pounds. So all that stress and all that pressure on that upper spine, when it's not structurally correct, not functionally correct, that is a major force being placed on that area, and it is driving those joints to break down at a faster rate. So we want to make sure these areas are working really well. Symptomatically, certainly we can look at loss of function. That upper spine, two of the big main functions that we look at in the upper spine is flexion, so head down, extension, head up, rotation, left and right. Those are the two biggies for that upper part of the spine, is that flexion, extension, and rotation. We want to make sure that the spine is working really well in those areas. So if we've lost function, we can only get our head up so high. We really want to be able to get your head up real high. I'm going to be a little restricted as well, but ideally, perfect motion would be that you can get your face almost parallel to the ceiling and be able to, on rotation, to be able to turn your head all the way chin to shoulder without any problems, without any discomfort. Another good check or test is, and we've talked about this in other videos, because the little workup we're going to do today, the routine we're going to go through, is all laying down. So if we're laying on your back, you should be able to get your head, your shoulders, your entire back, your entire spine pretty flat be able to get it flat to the ground or to the surface that you're laying on. Your head should not be restricted and have to force your head back. It should be able to rest smoothly, flat, the back of your head flat on the ground, flat on the surface. Or if you're against the wall, when we talk about doing chin tucks, we've talked about those in many videos before, but we should be able to get flat to the wall without having to force our head back and stress, put it in a stress position to get it back. It should be able to move naturally, fluidly, and very easily into those positions. So functionally, we want to check those out, but symptomatically, otherwise, headaches, whether it's tension-related headaches, migraine headaches, TMJ problems, jaw problems, eyes, ears, nose, sinus, chronic sinus problems, dizziness, vision problems, all can be a part of a loss of proper structure and function there, because neurologically, the nerves that come off of that upper part of your spine are the ones that are feeding throughout this entire area. So you open the door symptomatically for a lot of different types of health problems in this region of our body. So if you're having problems and having trouble figuring out the cause of the problem, and you haven't looked at that area as a cause of the problem, that should be identified and looked at and see what's going on in there. Like I said before, the routine we're going to do today is going to be done on your back, so laying down. So you don't have to leave your bed to do this. It's a really simple little procedure, a little routine that we're going to do, and we're always going to use our little progression of 3. So we're going to release the muscle tissue. We're going to stretch and open up those muscles and that soft tissue in that area, and then we're going to add a mobility movement to reset the nervous system or retrain those joints and muscles in that area to work better at a higher level. And again, if you're having problems specifically in this area, then that needs to be done consistently, meaning every day. Work that area every day so that you're driving that motion, you're driving that nervous system so that it resets and relearns how your body is supposed to move properly in that manner. So again, tools that we're going to use to release that area, we're going to use our rad roller. We call it a peanut because it looks like a peanut. We're going to use our rad roller here. I like the rad rollers a lot because one, they're really dense and firm, but two, they have a good grip to it, so they don't slide really easy, and that's good. So we can hit some specific areas without having it slide out from underneath us. So I like the rad roller for this spot. We're going to use to help stretch out the spine. We like our dental rolls that we use here. The dental rolls are awesome tools to help work the good curves that we want in the spine, to help stretch out, traction out the spine. But ultimately what we're working here with the dental roll is we put the spine into a specific position, laying over the dental roll, and that puts the spine into a nice, good curvature. And the goal of the dental roll is to really get to the ligaments of the spine. So your ligaments, just a little quick anatomy, physiology here, your muscles are what move your joints and bones. The ligaments are what anchor your bones together, whether it's in your knee, being held together by ligaments, your shoulder, your spine is being held together by ligaments. Muscles want to move, ligaments not so much. They like to be sit nice and taut and firm and hold that position real well. They don't have a lot of give to it, but when we've lost proper structure, well, we need to get those ligaments to start to creep or mold into a new position. The dental roll is how we do it. So this is a great way to stretch it out, that part of your spine. So we're going to work that again. It has a nice crest at the top, so we can get real specific into the areas we want to hit. If you don't have this, if you don't have either one of these, well, you can go on Amazon and pull up the rad roller and get these real simple. This, you can give our office a call. We can get one to you. But I will show you a way to work it laying on your back. If you don't have a dental roll, we'll give you a modification on that. So again, we're going to work our release, we're going to stretch, and then we're going to mobilize. So again, we're going to do this all on our back. So I'm going to lay on the back. The harder the surface, the better. So the floor would be the best position to do it, but if you're on a mattress or a table like this, great, no problem. But we're going to take our rad roller and we're going to put it right into the very top of our spine, right where your skull and your neck come together. That junction, we call it the suboccipital region. It'll probably be fairly tender when you get into there because all those muscles, all the restriction in there, they will be a little tender. Or they may be a lot tender, but that's okay. We need to work that out. So we're going to get that right into that soft tissue in there. And really just going to set your timer for this. We can hold it for a minute, 2 minutes. If you want to lay there a little bit longer because it feels good and comfortable, great. We're going to hold it up to a few minutes there. But let's just set the timer for a minute. We're going to hold that spot. Then I might move it into another position, work it at a little bit of a different level. And again, set the timer for another minute. And just play around with it. Now, the inherent structure of the spine, once I go too far, too low, it's not going to have any effect anymore because we do want that nice curvature in the spine here. So once I go a little bit below that level, I'm going to lose the effectiveness of the peanut. So stick it on, get it onto that upper part of the spine, work that area. Then we can add a little bit of motion to this as well. So your skull, on average, weighs 12 to 15 pounds, so we can use that weight to our advantage here. And all I'm going to do is, as I get it on that soft tissue, I'm just going to do a little bit of a chin tuck. What that does actually opens up those joints, and that gets me a little more access to that soft tissue in there. And I can just hold that spot for a little bit. I could do a little bit of repetition, just a little chin tuck, release, chin tuck, release. Adds that little bit of pressure in there and opening up those muscles. And we can do that 10, 15 times. And then if I want, I could add a little bit of rotation. I'm just going to stabilize with my hand here. I can add a little bit of rotation, rotate my head to shoulder, And I do get a little bit of extra work being done on that soft tissue in that area. And again, I can play around with the position. Don't be shy. Move it around. Find where it's tender. Work those spots. Again, set your timer. You don't have to go crazy with it. A few minutes, 5 minutes tops. And that's good for the rad roller. Then we're going to go right into our stretch. So I'm going to take my dental roll first. And I'm going to get that crest right at the very same spot we were just working. I'm going to get it right to the very top of the neck, right under the skull. So you can go about a ½ inch underneath the skull, get that crest on there. And basically what I want here is my jawline to be pointing up towards the ceiling. So I don't want it so that my head is getting pushed forward. I want it where my jawline is up, my head's rocking backwards, and that's opening up into these joints. And again, just set your timer, and you can lay here. Goal for this here, it would be 10 minutes total, what I would want to be on here. 10 to 15 minutes really tops, is to really allow those ligaments to stretch and mold into a position. If you're crunched for time, then do as long as you can time-wise. Get these muscles, those joints, those ligaments to open and stretch a bit. And we can do it that way. So that's a good little stretch there. Now, if we don't have the dental roll, so I'm just going to use the advantage of the edge of the table here. And all I'm doing is get to the very end of the table, and I'm just going to allow my skull to rock backwards off the edge of the table. I'm not getting it all the way off. I'm just going to get it so the back of my skull has a little bit of support on the edge of the table. Again, same position. Jawline is up towards the ceiling, and that's doing the same thing. Tractioning out, opening up that upper spine, getting those muscles, those joints to open and release. And again, just hold it here. Again, if you can do 10 minutes, great. 15 minutes. Otherwise, just want to progress. You know, even if you only can do a couple minutes at a time, because it might start to get a little uncomfortable, you start with 2 minutes and build your way up and just let that hold in there. It's a great way to stretch that out. The third component now would be our mobility. Again, I stay right here, and again, I'm going to use the advantage of the weight of my skull. I'm going to just slightly tuck my chin and raise my head just ever so slightly off the table so that I can get my hand just between my skull and the surface. And I'm going to hold that position. I'm going to do a chin tuck, release, chin tuck, and release. And I'm going to do this upwards of 15 to 20 times. Now, the whole time my head is being held off of the table, of the surface. So your head weighs 12 to 15 pounds. So let's say after 5 reps, you have chin tucks, you do 5, and these muscles, the muscles that we're working with this exercise, these front neck muscles, they're going to start to get really fatigued. So after 5, take a break, and then try to get 5 more. Goal is to get up to 20 done in that position. It's a great way to stimulate these front neck muscles. That's what we're trying to do, is really get into those front neck muscles, activate this, because most commonly what we see is the head's forward. These muscles get overworked. These muscles are underworked. So we want to stimulate and drive that, get those front neck muscles activated and get them working. But that's our routine to work this upper part of the spine between your skull and bones 1 and 2 of your spine. Great way to work that. If you have degenerative problems, this is a great way to get in there and start to work on those areas. Now, if you're doing things, you have a lot of pain, discomfort, well, that's something that needs to be a little further looked at by a professional, healthcare professional. Get that checked out and evaluated. Get this going, get it moving. If you have any problems, give us a call. We're here to help.